This is Catherine Ndinda, and I will be presenting chapter on gender equity with Dr. Benita Moolman, South African Government, Women's Empowerment and Gender Equity Responses to COVID. The presenters are myself, Dr. Catherine Ndinda, Dr. Moolman, Dr. Adebayo, Dr. Chimbwete, Dr. Ngungu, Ms. Gillian Marie, Ms. Alex Parker, Ingrid Lynch, and Fanezwele Shozi. So we are all contributors to this chapter. And even if we will not all present every section of the report, we will present the key sections. We start with an overview of the chapter, where we argue that gender-specific interventions and protection were implemented to mitigate the crisis on women and children. This chapter explores the extent to which the interventions implemented were responsive to gender-specific concerns of women, children, and vulnerable groups. The chapter assesses the extent to which women were able to access services during the different lockdown phases. We also conducted an analysis of the regulations and secondary analysis of various data sets. The DPME assisted us in organizing key informant interviews, which were conducted with DGs of various departments. We then analyzed those interviews using content analysis, and we used textual content from the interviews used to shed light on the interventions that government took to address the COVID-19 pandemic. In terms of the background, we argued that women are recognized, and we move from the premise that women are amongst the most oppressed social category. And this recognition has ensured that the UN maintains a focus on gender equality and women's empowerment. Gender equality is entrenched in the South African Constitution. Women's empowerment is a policy imperative due to decades of racism and sexism. In South Africa, the sectoral policies and programs reflect on this concern during the COVID-19 pandemic. What we have noted is that gaps exist in the regulations and in some interventions. However, we were able to draw lessons for policy and practice. In terms of the theoretical and conceptual framework, we use the work of analysts, feminists such as Kimberly Crenshaw, an African-American feminist credited with the formulation of the intersectionality approach that has been widely used in this country and in other places. When we speak about the gender and development approach, we note that there are differences between men and women, and these exist also in terms of race, class, ethnicity, sexuality, and so on. And therefore, the value of gender and development approach is in asking who between men and women benefits from the development programs or interventions by the state and other stakeholders. What are the outcomes of these development interventions? And essentially, which women benefit from development interventions? In terms of intersectionality, we argue that using a homogeneous approach is not very useful because it overlooks the differences among women. And therefore, our argument in this chapter is that women cannot be considered from the singular lens of gender. We must view women in terms of race and other variables. We argue that race intersects in complex ways with gender to amplify the disadvantage of Black women. In South Africa, race intersects with gender to amplify poverty and inequality. The GAD and intersectionality approaches are valuable in exploring the effect of state interventions, and therefore our argument is that gender in policies, programs, and regulations implies addressing strategic gender needs. These include healthcare, education, income, housing, and public transportation, protection from sexual violence, and action against the feminization of poverty. In terms of using a gender-responsive approach, we need to include the distribution of resources and access to public services for the care of children, disabled persons, and the elderly, because when this is not done, women without support end up carrying that burden of care. In terms of gender equality, our argument is that it is about the equal access to opportunities for both women and men to participate in every sector of society and the economy without barriers. In terms of gender equity, our key point is that it's about fairness. For fairness to be achieved, it requires interventions so that historically disadvantaged individuals can compete on the same terms as the privileged. Equity results in equality. From this point onwards, we are going to present the findings, which have been organized in terms of the gender analysis of regulations, and then we will look at human settlements and gender-based violence, maternal and child health, and then the recommendations. In March, when the national disaster was announced, the regulations were developed swiftly to manage and control the implementation of the lockdown and the disaster that was declared in the country. The COVID-19 regulations sought to help the country navigate the epidemic of disease and fear that accompanied the media reports on the COVID-19 pandemic. This was really something that affected the country in an extraordinary manner, and also it affected the globe in a very profound way. The regulations were necessary, but some gaps then emerged in terms of the implementation. We note that not all regulations were necessarily gender sensitive, and some gaps emerged in their implementation. We note also that the principles of gender equality and non-discrimination, human rights, and respect of human dignity should have been considered and applied across the different regulations and their implementation. During the lockdown, the DTI published a list of 22 categories of items that the National Consumer Competition would monitor to guard against unjustified price increases. These included basic food items and other essential items considered necessary for survival. The regulations, however, overlooked some items that are critical to practical gender needs. These included clothing for babies, toddlers, and maternity items. With the CGE intervention, this allowed the sale of clothing for babies and toddlers. However, we still noted maternity items were still excluded. We also addressed the question of stigma. The requirement for self-isolation and quarantine and how those who perished from the pandemic were buried aggravated stigma around the pandemic. We have already addressed the question of essential items. We also looked at the issue of basic education, communication, unpaid work, and working from home. What we noted about all these different topics is that the practical and strategic gender needs of women should have been considered in the drafting of the regulations, because both practical and strategic gender needs impact on women, whether it is during the disaster phases or out of disaster. And therefore, that should have been a guiding principle and framework in the design of the regulations that were issued to the public. We now move on to the next topic, which is about gender-based violence, and my colleague, Dr. Moolman, is going to present.
Thanks to my colleague, Catherine Ndinda. So in terms of the definition, we're looking at the general term used to capture violence that occurs as a result of the normative role expectations associated with a gender associated with the sex assigned to a person at birth, as well as the unequal power relations between the genders within a context of a specific society. Gender-based violence includes many types and many forms of violence, including physical, sexual, verbal, emotional, and psychological force or threats of such acts or abuse, coercion, and economic or educational deprivation, whether occurring in public or private life, in peacetime and during armed or other forms of conflict, and may cause physical, sexual, psychological, emotional, or economic harm. Just looking at some of the statistics during the COVID-19 pandemic and the lockdown periods, domestic violence and intimate partner femicide, we see that during April to June, there were over 20,000 reported cases, and in 2020 and 2021 period, which was the hard lockdown period, specifically the first quarter, we had over 32,000 reported statistics. We do see, if we look across the categories of gender-based violence, which include the domestic violence and intimate partner femicide, but also include sexual violence such as rape and sexual assault, that the statistics increase as the lockdown levels decrease. The perpetrators remain boyfriends, husbands, and partners, no surprise to many of us, and increasingly brothers and police officers are represented. So looking at gender-based violence against the LGBTIQ plus community, NPOs continue to provide service during lockdown, mostly but not exclusively online. We see the continued violence, family violence against transgender women. Often transgender women need to be moved out of their homes to ensure their safety. It was obviously harder during the lockdown period due to the COVID-19 protocols and isolation challenges, particularly in regard to looking at safe homes and safe houses, and what those challenges, what challenges presented during that time. The South African Police Services and gender-based violence, we see very little implementation of the standard operating procedure on the detention of transgender persons in conflict with the law. Another example of a young woman, Robin Monsumi, was a sex worker who died in police custody during lockdown period in June 2020. There were several media reports on the experience, and there were several protests by NGOs who protested and wanted information from police around what was happening or what happened with regards to the death of Robin. NGOs lodged a complaint about a case with the Human Rights Commission. An investigation has been promised, but has not been forthcoming. Another case of a transgender woman raped in police custody during lockdown has been taken up by the Lawyers for Human Rights. Moving on to maternal and child health, and looking at some of the indicators, we see that in some ways it's a little bit uneven. So pre-pregnancy, in terms of an indicator of couples accessing health services, we'll see that there was a drop, 51% to 31.8% in April. And in terms of comparative years, we usually see 60 to 68%. And so we can see that drop. The antenatal visits, the first visit before 20 weeks, remained relatively the same that we usually see around May. So 69%, and the comparative is 69% as well. Looking at delivery and postnatal visits, we see deliveries and births at facilities is the lowest in May and July. And then mothers' postnatal visits within 6 days, we see that again, there's 79.5 to 83.5, relatively similar to the comparison of 80%. The delivery by C-section, we see 29 to 32%, so an increase, and then the comparison is usually 22 to 26%. In terms of the maternal and neonatal mortality, we see that the maternal mortality, we see that it was quite low in May in particular. But also in March, we start seeing it as being the lowest, and then May fairly low, and it starts again as the lockdown levels increase, mortality rate looks a little bit better. Similarly, with the neonatal deaths, we see that in June was the lowest point in terms of the deaths of young infants, and it slowly begins to increase again in July. In terms of infant immunization, we see that the measles, for example, was the lowest in April. Most of the immunizations were the lowest in April, which is understandable. It was the hardest lockdown and mobility was restricted. And we see that's reflected in the immunization patterns for infants. It increases as the lockdown levels decrease. So with the highest levels as we move across July of 2020. Just looking at a specific case study based in the Gauteng. We're looking at more women, 56% than men, that tested positive for COVID-19, and the gender gap started and widened from lockdown level 3. As of the 11th of August 2020, 23,011 more women than men had tested positive. The ratio was fairly consistent from March until October 2020. The gender split for the population in Gauteng is 50-50. And then internationally, there are more female cases than male cases in developed countries, reverse in developing nations. Yeah, and you can see the represented here in the graph. Continuing with the case study, the testing data for South Africa shows that a similarly higher proportion of women are being tested for COVID-19 and a slightly higher proportion are testing positive as well, based on week 32 data. And you can see that from the NICD statistics and study. Women may be testing more than men for a number of reasons. As part of pre- and post-natal care, they may be having routine tests. Women who experience symptoms may be better at seeking care. Women may be experiencing symptoms at a greater rate for various reasons. And globally, some 70% of healthcare workers are female, driving a higher rate of female tests and infection cases. Women are more likely to live in larger households, so there's an increased risk of intra-household transmission. Larger households are associated with a lower quality of life and more likely to have resource constraints. Net job losses between February and April were higher for women than for men, with women accounting for 2/3 of the total net job losses. Wow. So once again, we're looking at the statistics. It presents a double burden on women, an increased risk of infection, as well as an increased risk of socioeconomic impacts. And I think just in conversation with Catherine, who presented a little earlier, around the intersection of race, of course, that's not only a double, but a triple burden because of the impacts on particularly Black women. I'll hand over to my colleague, Catherine Ndinda.
So in this section, we speak about human settlements and then we give the recommendations. So this chart represents the housing typologies where different groups of people live, and it's just a gender disaggregated type of slide where we see where women and men live in this country. But I'll only comment on just a few statistics on the next slide. So we note that women's role in the home is eased or hampered by inadequate shelter, infrastructure, and services. Women are represented and overrepresented in housing typologies with poor conditions. For example, in that chart that you just saw, 66% of women live in rooms and 61.6% live in traditional dwellings. Informal settlement dwellers are 50.3% of women, and those who live in informal dwellings and shacks are 48.3%. Now, there's another statistics that's a bit concerning where women who live in what we consider the other are 84%. What we note about these housing typologies is that they mask overcrowding, lack of services, and insecurity. The housing typologies where women live represent poor living conditions. Our question and our concern is, what was the impact of COVID-19, given that women live in such poor housing typologies? So we note that housing conditions are exacerbated by vulnerability to the pandemic. And here we give the examples of women in different housing settings. Those in hostels live in overcrowding, poor sanitation, and with lack of services. The lack of security enforced on women and girls for longer hours resulted in affecting them very profoundly in terms of their quality of life. Their vulnerability to COVID-19 infection as a function of living conditions and transportation conditions was aggravated or increased. For women in informal settlements and informal dwellings, what we note is that urban informal areas have the largest share of very poor households. African and colored women are overrepresented in informal settlements. Although they were protected from eviction by the regulations, some were still evicted as a result of the actions of different municipalities, such as the city of Cape Town. We note that in terms of the different groups of women, domestic workers account for 15% of women's employment. Now, about 95% of domestic workers in this country are women. They live in poor housing conditions. 63% earned more than 2,500 before the pandemic. However, during the pandemic, 74% earned less than this amount during the lockdown. We also note that 69% could not afford to pay for their rent during the lockdown. Other critical statistics indicate that 57% of domestic workers fell behind with their rent payments. 8% borrowed money for rent. 4% moved to cheaper accommodation. Most did not know how they would ever cover their rental arrears. We also note that 75% of South African domestic workers reported that a household member had received some form of grant, for example, elder person or child support grant during the pandemic. 87% had their normal grants increased or received some special COVID-19 related benefit. We note that only 4% of migrant domestic workers reported government support. So overall, domestic workers represent a vulnerable group among women in this country. And because most of them are Black and most of them are single mothers, their vulnerability was amplified by the COVID-19 pandemic. Refugee and migrant women are also another vulnerable group of women. So they exhibit many of the indicators already discussed. What we note is that whereas some of the refugee and migrant women may have benefited from the regulations that prevented eviction and demolition of dwellings, others were evicted anyway. When we look at the affordability of home loans, women are also part of those who own homes, but then disaggregated data was not available. Amongst the 4 big banks that offered loan payment relief for 3 months, we speculate that women also received such relief. However, the relief was selective. Households not already in arrears and earning only up to a certain income were included. The relief was potentially exclusive of vulnerable homeowners, many of whom are women. Women may have been forced to take the payment holiday that was offered. We note that many women tend to earn less and were therefore worse affected by the lockdown in terms of the affordability of their home loans. In terms of the government responses, so we have already discussed what the living conditions of women were during the lockdown. And therefore, we asked what were the government responses, and what we found was that government fast-tracked the housing allocation in places like Kutong informal settlements, where 1,500 households were approved for relocation to newly constructed units by June in 2020. There was also dedensification of hostels, where 1,000 temporary residential units were constructed to densify households living in Mamelodi hostels. In the same period, 70 units were built in 3 weeks for victims of farm evictions in Johannesburg. In the 2021 financial period, the HDA delivered 8,000 housing units using alternative technology. The government also allocated 4.6 billion for upgrading of informal settlements. Another 831 million was allocated for the provision of emergency response housing for women, children, and the elderly. Another 600 million was allocated for relief to social housing tenants that could not afford to pay rent due to COVID-19. Recommendations. Based on what we have presented in these slides and based on what's already in the chapter, we note that without gender mainstreaming in interventions, women's empowerment and gender equality cannot be achieved in the context of COVID-19. Disaster policies, regulations, and interventions need to be gender responsive to ensure that gender empowerment and equality are achieved. We need the development of a system of removal of the alleged offenders from shared residence with the victims of GBV. We note that data sets should be disaggregated into gender and race, and where data is unavailable, rapid studies need to be funded. We also note that residential data needs to include more variables, for example, on different forms of tenure. Our conclusion is that we need partnerships between the state, banks, and private landlords, because these are critical in ensuring that vulnerable tenants are protected from evictions during disasters like the COVID-19 pandemic. Thank you.